On many people's wellness plan here at Sedona Wellness Retreat, we have B12 injections that, if you're comfortable, you will administer to yourself. So B12 is a very important nutrient. It's essential for the function of every cell in your body, but most importantly, it's necessary for your neurological health, the integrity of your DNA, your red blood cell production, and the function of your immune system, all of which are very important when you're healing and when you're doing intensive detoxification like you will be doing here. For many people, the notion of giving oneself an injection is not a pleasant thought. Now I'm here to tell you that this is very quick, it's very easy, and it barely hurts, if at all. So, if this is on your wellness plan, you will see B12 shots on your wellness plan, and you should be receiving a vial full of pre-filled syringes with your name on it. So here I can see this is mine because it says Dr. Forrest, my date of birth, and the date. And the instructions are right here, and they're also on your wellness plan. So in each one of these injections, there are 2,000 micrograms of B12. And it says take 1 injection daily as directed. So a good time to do this is right in the morning when you're taking your vital signs, when you get up. If you don't have a refrigerator in your room, this will be stored in the refrigerator by the vital sign station in the gathering room. And so you open this up, you'll take one of the syringes out, you'll make sure you have your sharps container handy, and let me just show you this. First of all, there's only a few drops of liquid in here. Second of all, this is an insulin syringe, which means the needle is basically 1 millimeter long and so thin that you barely feel it. And third, this is not an intramuscular injection like most vaccines are, where it actually goes in your muscle. This just goes into basically your fat layer, which you barely feel. So, you're going to open this up. Well, actually, before you open this up, it's best to clean the site. So you want to select a site on your body where you're going to do the injection. There are several good options, but you basically want to find an area that has a decent fat layer. Now there is a fat layer covering our whole body, even if you're a really skinny person. So don't worry if you're very thin, you'll be fine. Usually the upper thighs, right here, are good areas, and the lower abdomen, right here, are good areas too. And it's important that each day you rotate sites, so you don't want to inject it in the same place every day. So, I'm just going to expose part of my abdomen here, and I'm just going to pick a spot. So, I'm going to pick this spot, and you're going to use an alcohol prep pad just to sterilize the area for good measure. Wipe the spot you're going to inject into with a circular fashion like this. Give it a few moments to dry. Pop the top off of the syringe. Pinch the area and pull up a little bit. And then go in on a 45-degree angle. And just go in pretty quick like that. Hardly felt that at all. And then slowly push down on that plunger until it's empty. You can use that same alcohol pad to just clear off that area. Now sometimes afterwards, maybe a couple hours later, you'll notice that a small area of your skin is stained with the red color of the B12. That can happen sometimes, that's normal, don't worry, and it'll go away within a day or two. Once you're done with the injection, you just put this into the sharps container. I have a habit of putting the cap back on. You're actually not supposed to do that. Don't do that because the odds of you stabbing yourself in the finger are very high. So don't worry about the cap or putting it back on. Just put this needle side down into a sharps container. And then close the top. Put your vial of syringes back in the refrigerator. And you're good to go until the next day. Some people really can't tolerate giving themselves injections, and if that's you, don't be ashamed. Just let us know and we'll give you the injection so you don't have to do it to yourself. And that's it.